Hello, and welcome to the webinar for the Circle of Care, University Hospitals Kingston Foundation. My name is Evelyn Mason, and I am the chair of the board of directors of UHKF. Just for your information, this webinar is being recorded and will be available on our website and YouTube channel. We expect the webinar to last approximately 35 to 45 minutes. There'll be time for questions at the end, but you can ask a question at any time during the webinar using the Q&A feature on your device. You are here because you are among our most valued donors and volunteers, and we thank you for your continued generosity. The Circle of Care events are held 3 times each year, but for the last 2 years plus, we've had to hold these meetings virtually. We hope the next time we'll be able to get together in person. The purpose of these Circle of Care events is to provide donors like you who are at the Champion or Ambassador Who Care annual giving level, our monthly donors, and our evergreen members who have confirmed a legacy gift, a special opportunity to connect with some of our outstanding healthcare and research professionals. We're very fortunate today to have Dr. Elise Leonda, PhD and postdoctoral research fellow at the Human Mobility Research Laboratory with us today to talk about the potential to use markerless motion capture in the clinic for a better understanding of how we move. Welcome, Dr. Leonda.
Thank you so much for the introduction, and thank you so much for the invitation to present today. I'll start sharing my screen now, and I'll jump right into the presentation. So hopefully it's showing there. So I'm talking today about markerless motion capture technology and how I think we can use it to really help understand how we move and improve research. So motion capture for understanding human movement is something that has been studied for a long time. And we have demonstrated that it provides valuable information for looking at diseases like knee osteoarthritis and for informing clinical decisions, but it's been a bit challenging to use in a clinical environment. And before I get into that, I'm going to go backwards in time a little bit and talk about motion capture and where it came from. And this is one of the first recorded instances of motion capture, and this is from 1878, and it was a bet about whether all 4 hooves of a horse left the ground during running. And so Muybridge in 1878 set up a tripwire system that set off cameras, and it allowed motion capture to be performed in order to prove that indeed all 4 hooves leave the ground while a horse is galloping. And then not too long after that, the first instances of motion capture for humans was started as well. And you can see this image of someone instrumented up for motion capture. And to be totally honest, it isn't that different from what we have used in our laboratory at the Human Mobility Research Lab at Queen's University for many years. And until recently, this was really the state of the art for motion capture technology. And so we call this marker-based motion capture. And the way it works is that markers are placed on anatomical landmarks on the body. So it requires an operator to palpate the participant and figure out where that bony landmark is, and then put a special reflective marker on the skin. And these markers let the infrared cameras track where that person is moving through space. So this is an example of our most recent master's student who just successfully defended his master's yesterday. And this is what a marker-based motion capture setup looks like, where you can see the reflective markers being placed. And you can also understand and appreciate that this isn't maybe the most uncomfortable clothing situation for most participants. It also requires an expert user to place the markers on. And there are a number of limitations with this technique. So one is that because the markers are reflective, a very special environment is required where there's no additional light. It can only be done in a laboratory. the markers have to be placed by someone who knows how to put them on. And if they make an error or if they put them on in a slightly different position when the participant comes back, that can change the results. And as well, these markers may move on the surface of the body. So when you think about marker-based motion capture, I think we're all familiar with it for both research applications and then for things like computer graphic images in movies. But now we have the opportunity to do markerless motion capture. And this is really exciting because it can change not only the way we record data, but the kind of data we can record. And to give you a little bit of background on how it works, this is actually a company that's local to Kingston called Markerless. It was founded by 2 former graduate students from this laboratory. And the way that it works is that it uses standard video cameras that are recorded synchronized from different perspectives. And it uses a deep learning algorithm to estimate landmarks on the surface of the body. And so this algorithm essentially replaces the physical markers that were put on the body in previous marker-based technology. And then once you have those landmarks, then the procedure from there is the same as with marker-based. When we do a data collection in our laboratory, it's a very different situation than what happened with marker-based. So the participant doesn't have to wear anything. There's no preparation time. They don't have to wear anything special. There's no preparation time. And we use these video cameras to record the participant and to build these 3D models. So one of the biggest benefits is that it really changes the length of time it takes to capture data. So this was very time consuming. In addition to being quite burdensome to the patient, it took usually about an hour to do a data collection. I don't know if you caught that because it went so fast, but it takes us about 2.5 minutes to collect exactly the same data now with a markerless system. And what are we interested in studying with this technology? Definitely knee osteoarthritis is one of the research areas that our lab has focused on. And one of the problems with knee osteoarthritis is that it currently has no cure. And it's been very hard to research using marker-based technology because the data collection has been so onerous. And because variability in the way markers are put on means that it's been very difficult to combine data that was collected at different sites. So even though lots of groups in Canada and around the world have performed marker-based data collection, we haven't been able to pool that data together to have a stronger signal in performing this research. And right now, one of the only ways that we treat knee osteoarthritis is with a salvage procedure, essentially, which is total knee replacement. And again, there is so much we can learn about how knee replacements work when we can analyze large data sets of how people function. Another consideration for what we should be studying with markerless motion capture technology is also ACL injuries. And this affects women much more often than men, especially young women who are performing athletics. And this is of personal interest to me, not for myself, but this is actually an X-ray of my best friend who had an ACL injury in 7th grade and ended up needing a knee replacement before she turned 40. And we really have a huge lack of information on how knee replacements work in young populations, as well as what leads to this ACL injury creating the need for a knee replacement later. And this is one of the gaps that we can fill with markerless motion capture technology, where we have a much more accessible way to collect this important data. And just to sort of highlight why we need to be doing this motion capture, one of the interesting things to think about is how the knee joint is actually an organ, just like the heart is. And the definition of an organ is that it's a collection of tissues joined together in a structural unit to serve a common function. So for the heart, that's to pump blood. But for a knee, that's to facilitate movement and transfer forces across the joint. And when you have an issue with your heart, all of the assessments that are performed on your heart are done while the heart is working. So you're looking at blood pressure, ECG, all while your heart is functioning. However, when we look at knees, all of the assessments that we do are done while the knee is at rest. But all of the problems that we have with our knees are while they're moving, while they're functioning. And that's why using motion capture technology is really going to change the way that we can assess knees. And so what we'd love to do is replace something like this static X-ray with a really dynamic 4-dimensional, so 3-dimensional and then through time assessment of our joints, because that's how we use them. So how can we use this markerless motion capture technology to study knee OA? So this is something that we're just starting in the lab. I should highlight that this technology is very new. We're 2 years into using it, and we've definitely seen improvements in how well the algorithm works. And we're interested in not only understanding how well this technology works, but in also figuring out what functional tasks are going to be the most useful for us to develop objective assessments of how someone's joint is functioning. And so that's active research that we're doing right now, where we have patients who come down from the clinic upstairs. We're located in Hotel du Hospital. So after they've seen a physiotherapist and been deemed to have severe knee osteoarthritis, they come down to our lab and we're doing a series of assessments. So looking at walking, which we're obviously very interested in, but also things like stair climbing and balance to really understand which of these assessments are going to be the most useful. And I do want to highlight that compared to the marker-based technology, the markerless technology is really accessible. So it allows us to study patients when they come from the clinic. It doesn't require any extra preparation time. We can have patients using their standard mobility aids. We can have somebody walking with them if they do have issues with mobility. And this is really changing the kinds of patients that we can capture as well. And you can see, even with someone wearing a skirt, we can still estimate where those landmarks on their body are, which is really the power of this deep learning algorithm. And people refer to these as the squiggles, but when we look at the results from our markerless and marker-based motion capture technology, what's really reassuring to us is that this is the very first study that has been done on patients with knee osteoarthritis using markerless motion capture. And we're getting the same data that we got from our previous marker-based study. And so this is important because it shows us that we can use this new technology and we'll be able to expand upon the findings that we have from our previously collected data. And other than just looking at knees, which is my personal interest, but I know that other people have other interests for research. One of the really exciting things is that this technology is portable. So because we're using standard video cameras, these are essentially, they look like little GoPro cameras. They're a Sony camera. You can buy them at the camera shop downtown in Kingston. And we can take this system anywhere and we can take it outdoors. And that's something we've never been able to do with marker-based motion capture technology. It also means that we can take the technology to the participants instead of having them come to us. So this is an example of us setting up in the university, in one of the university halls. And we got a little bit faster, but it allows us to capture large amounts of data in a short period of time. And so we have been able to capture data on about 450 participants in 7 days. And this is just a huge amount of data compared to what has historically been done. So the entire history of the lab, I think they had 140 data collections and we did 450 in 7 days. So this is really changing the scope of the research that we can do, and we can start looking at almost epidemiological scales for how people walk. So we're collecting lots of data on a general population, and this is to create a control data set. And that is going to allow us to compare clinical populations as well. And so one of the research projects that we're also looking at is working with Dr. Steve Scott who is a neuroscientist, and he does a lot of research on stroke. You may know him from the kin arm. And so he's also interested in this technology to see if we can quantify how patients are recovering after stroke, to see if medications are effective. And again, we're looking at different tasks to see what is the most useful for that type of assessment. We can also measure things like balance, and this is really important for a stroke population. And this is showing that we can sensitively measure different ways that people maintain balance. We can also improve existing clinical measures. So the timed up and go test is a very straightforward clinical test that has demonstrated utility. And right now, the only output, the only measurement is the total time that takes someone to complete the timed up and go. So rising from the chair, walking around and returning to the chair. But there's so much more data in how someone executes this task that could be really predictive of their functional status. And so this is something that we can collect quite easily, and we are actively investigating how it can be important for clinicians. We can also measure things that we've really never been able to measure with marker-based technology before, such as yoga. So yoga has been demonstrated to have great health benefits, but we really don't necessarily understand the science behind how those functional movements impact that, and can we start to evaluate that? So with marker-based technology, the markers would get in the way, they would get bumped, they would fall off, or they'd be hidden by these different very complex poses. And so looking at using markerless motion capture technology, we really have new opportunities to measure this. And then we can also measure group settings, so multiple people performing yoga together. And of course, there's a lot of interest in using this for sports analysis. So this is an example of a sports team that is also using markerless motion capture technology, again, because you can take it into the field. And this really can change the way we can study sports performance, as well as looking at sports injuries, because we can measure the participants in the environment where these things are actually occurring. One of the other benefits is that by removing the limitations for putting markers on and how that can be variable and change the data, we can bring patients back time and time again, and we're confident that marker placement errors aren't affecting our outcomes. And so this means maybe we can start to look at how people learn to walk over their entire lifetime. So this is actually my 5-year-old, and I bring him into the lab whenever I can, because I think it's going to be really interesting to have an assessment of someone's gait as they grow and develop, and possibly age as well. So I do want to highlight that this is still early days in how we're measuring human movement using markerless motion capture technology, and that there are things we do need to consider. One of the things that I'm really motivated to look at is looking at more diverse populations, including diversity in age, but also ethnicity and sex and gender. And I think that as researchers, it's really important that we think about this upfront, and we don't make assumptions that something that was tested on a certain population will work for all populations. And then because it is video data, we do have privacy concerns. Ironically, the COVID-19 pandemic means that everyone has been masked in our lab, which alleviates some of those concerns, but it is still something we need to think about in our research. All that being said, I think that the opportunities of markerless motion capture are really exciting for changing the kind of research we can do and the way we do research. And I think that one of the most interesting things is going to be multi-center studies where we can compile large data sets collected in different locations, as well as taking our research to the participants instead of asking them to come to us. And I think that there's going to be a lot of exciting research that comes out of this technology. So I want to thank you for your attention, and thank you to the Foundation for the invitation today. And I'm more than happy to answer any questions that you may have. Thanks so much. Okay, and I am figuring out how to use this. Okay, so I have a question in the Q&A, and it says, because of its structure, the body can only move in certain ways, and people move according to their structure. So what is new? So people have different structures, which I think is an important consideration. The other thing is that structures change. So with something like knee osteoarthritis, what's happening is that your cartilage is degenerating and it's changing the structure of your body. And so understanding if there's something in the way that you move that changes your structure or vice versa is an important way to think about understanding how disease progresses, why certain people get diseases, and as well to think about how treatments can be modified for individual patients. And I'm happy to answer more questions. So hip replacement, absolutely. So we can measure and study hip replacement exactly the same way that we're studying knee replacement. And in terms of walking errors, I'm going to interpret that as something like a trip or a fall. So we have definitely talked about using this as a way to screen for people who are at risk of falling. And I think that this is another application of this technology that could be really important for predicting fall risk and helping to put safeguards in place for someone who is deemed to be at a greater risk of falling. Okay, and I'm going to stop sharing my screen and minimize it so that we can see other people if necessary. Increasing gait analysis is an open question right now. I'm hoping that yes, we will be increasing gait analysis in terms of the number of patients that we can analyze and just the volume of the data so that we have a better representation of gait variability across the population as well. And I will also mention quickly that we are doing ongoing data collections. So if anyone is interested in participating, we are hoping that we will be able to join possibly some of the events of the foundation in the future. And we can do, because our system is portable and mobile, we can come to an event and we can set up just the way we've done on the university campus and hopefully include some of these viewers in our data set as well, as we're trying to increase the size of our data set. Okay, so another question, how does a patient reach the gait stride? I'm not sure I understand that question. I'm afraid if you want to add some further text to clarify that. And in order to come and participate with our research questions, does your doctor or nurse practitioner have to refer you? So right now, it's not required, but the way that we have been gaining access to patients is through the physiotherapist office in Hotel 2 Hospital right now, but you would be more than welcome to contact us if you would like to participate in the study and come into the lab in the meantime.
There are no further questions. You can let me know, Elise, if something pops up.
Oh, I have two more just popped up. Do you have any way to increase stride length in gait? So that is, I guess, something that could be done with Gait training. It's not something that we do right now, but there are other groups that have looked at that, looking at ways to retrain Gait if there is a hypothesis that the Gait, the way someone's walking, changes how the disease is progressing. And the last question here is, how will you deal with the adverse effects of technology affecting the energy of people, as we are advised to stay away from technology when going to bed to avoid some of the poisoning effects? So when we're doing this data collection, the technology is actually invisible to the participant. So we have video cameras that are recording you. They're very small, they're about this big, and you're not actually looking at the screens yourself. And a further question, knee replacement is generally undertaken after other treatments. Do you foresee applications of this technology for other treatments like the effectiveness of bracing, etc.? Absolutely. So we do have an ongoing discussion with one of our orthopedic surgeons, and they want to look at the effectiveness of injections to relieve symptoms. Agreed that it's great to try to avoid surgery as long as you can. So that is one thing that we are actively looking at. And yes, we have studied the effect of bracing with motion capture before. So I agree that this is another great avenue that we can investigate with the Markerless motion capture technology. Thank you. Okay.
Thank you so much, Dr. Lande, for your presentation today. It's really interesting to see how motion capture technology has progressed from the late 1800s to today. And I look forward to learning about the applications to which this technology can be applied. It's simply fascinating. It's really out of the sci-fi realm that I'm familiar with. As I mentioned earlier, this video will be available on our website and YouTube channel. You can share it with family and friends. Watch it as many times as you like. Thank you all for joining us today and for your continued support of our healthcare facilities in Kingston. Just a couple of housekeeping measures. The UHKF 50/50 lottery was relaunched on September 7th. After a short break over the summer, and the next draw takes place October 5th. 2 early bird prizes of $1,000 and $500 each. You can get your tickets before September 22nd to have 3 chances to win. And this time there's a ticket bundle of 600 tickets for $75. And starting on Monday, you can buy your Tim Hortons Smile cookies at all the local Tim Hortons restaurants. All the proceeds from this year's local Tim Hortons go to KHSC NICU. And there are pre-order forms available on our website, uhkf.ca, in case you want to order a dozen or more cookies for family and friends. I know I keep a stock in my freezer. I would ask you to please complete the survey about this webinar that you'll receive following the webinar. Thank you again for joining us. Hopefully we'll be able to see each other in person at the next event, and hopefully we'll get out to enjoy this wonderful, beautiful fall day. Thanks again. Bye.